Every day, women ask us if certain signs and symptoms are normal when they are pregnant. But unfortunately, sometimes the answer is no, you should see a doctor.
Right. So we decided that we need to record a video in which we help you understand which signs in pregnancy are not normal and when to see a doctor. I am Natalie, a pregnancy and birth consultant and TCM therapist.
And I am Matthias, a researcher and science geek, and our mission is to help mummies and their babies naturally and science-based. So let's get started.
Of course, a certain degree of nausea and vomiting, which is referred to as morning sickness, is not uncommon when you're pregnant.
Yeah.
And normally, morning sickness does not put your baby at any increased risk.
Yes. However, if you do suffer from severe nausea and vomiting, so that you cannot even keep water or other fluids in your stomach, or if you have not been able to keep food down for 24 hours, then you should let your doctor know straight away.
Right.
That said, there can be many different reasons that can cause severe vomiting. For example, an infection or food poisoning, right?
Right. But it could be what is called hyperemesis gravidarum, which is the medical term for severe nausea and vomiting during pregnancy. Whatever the cause though, severe vomiting is always risky for the baby because of the mother's dehydration and possibly weight loss. Therefore, you should not hesitate to call your provider, okay?
Right. While headaches can be normal during pregnancy, severe persistent headache is not.
Right.
So headache that suddenly starts with severe pain, headache that persists despite the intake of fluids or medications, and or headache that is accompanied by dizziness or blurred vision is a warning sign, which is why it is recommended to consult a doctor.
Right. This can be a sign of gestational hypertension, which is a condition which involves high blood pressure during pregnancy. And in more severe cases, it could also be a sign of preeclampsia, which involves high blood pressure too, but in a more severe form.
Yes, both can lead to severe problems for both the baby and the mother, which is why it is very important to diagnose it as early as possible.
Right.
Vaginal bleeding, even when it's only just a small amount, can point to all kinds of problems, but it depends a bit on the trimester.
Right.
During the first trimester, generally speaking, vaginal bleeding is not uncommon. However, in very rare cases, it could also be a sign of miscarriage, particularly if you also suffer from abdominal pain at the same time.
Right. Or it could be that the egg implants outside the uterus, for example in the fallopian tube where the embryo cannot develop, unfortunately. And finally, vaginal bleeding can also be caused when the placenta lies very low in the uterus, covering part or even all of the cervix.
That said, providers are often more worried about bleeding in the second and third trimester because then it could be caused by an abruption of the placenta, or it can be a sign of preterm labor.
Right.
So whatever the trimester, you should always call your doctor when you experience vaginal bleeding.
Right. Now, first of all, please note that very often abdominal pain is the result of very harmless causes. Like, for example, it could just be the result of a growing womb or ligament stretching. But in some cases, it can point to more severe problems.
Yes, so whenever you experience cramp-like or a stabbing or a sharp pain, or when it starts suddenly and is severe or gets worse over time, then you should not hesitate to call your provider.
Right.
Similar to vaginal bleeding, the possible causes of abdominal pain can be related to your pregnancy, which means that they too depend on the trimester. But it could also be a sign of problems which are unrelated to your pregnancy, for example, appendicitis or gallbladder disease. But you won't know until the doctor had a closer look at it, right?
Right. Mild itchiness is not uncommon during a pregnancy and thus normally not a reason to worry, okay? But if you suffer from severe itchiness which occurs all over your body, particularly your hands and feet, even when there is no rash, then it could be a sign of pregnancy cholestasis.
Yes, this is a liver condition and a particular concern in the third trimester because it can cause all kinds of complications for the baby, in particular a preterm birth.
Right.
And just that you know, the itchiness does not necessarily only start in the third trimester. It can also start earlier.
Right.
So please do consult a doctor if you do suffer from itchiness in your pregnancy.
Right. So if your vision is blurry, if there are blind spots, or if you see spots or flashes, or if you see double, then please call your doctor immediately. That's particularly important if it happens at or after week 16 of your pregnancy.
Yes, these can be signs of preeclampsia, which we have already mentioned earlier, which is why it is very important to diagnose it as early as possible.
Okay.
Most mummies experience swelling, particularly in the last trimester of their pregnancy. However, what we are talking about is a more extreme form of swelling, one that makes it very difficult for you to bend your fingers and or which makes your eyes look very puffy, right? This too can be a sign of preeclampsia, which is why it is very important to talk with your doctor about it.
Right. Now, first of all, please note that pregnant women in general have a much higher risk of deep vein thrombosis. That's quite obvious given the fact that the growing uterus puts more pressure on veins, which obviously is bad for blood circulation, right?
Yes, but the main problem here is that it is very difficult to identify the signs of a deep vein thrombosis. However, swelling and pain in your leg can be an important warning sign, particularly if the swelling only just occurs in one of your legs and if the area is warm to the touch. What's more is that sometimes that swelling is not restricted to your leg only. It could affect one side of your body, which would then appear to be redder and warmer than the other side. When that's the case, please immediately call your doctor because a deep vein thrombosis is basically a blood clot which may travel to other parts of your body where it can cause severe problems, right?
Right. Feeling your baby in your room is really a sign that your baby is well. And so logically, if your baby is suddenly less active, then it could be a sign of fetal distress. However, it is important to note that babies are not active at all times, okay? They have a certain pattern. And that pattern varies from baby to baby.
Yes, in general, babies like to be more active after you had some food or drink or when you rest because then your baby no longer feels those nice rocking sensations from when you walk around. And so rather than just randomly observing your baby's activity, it is important to look out for a change of pattern in your baby's movements.
Yes. Because of that, providers recommend counting your baby's kicks during a time when the baby is normally very active. And they also recommend doing that regularly from week 28 of your pregnancy onwards. So if you want to know how to correctly count your baby's kicks, check out the description below this video.
Yes. Trouble breathing can manifest itself in many ways. For example, it could mean shortness of breath that suddenly appears or develops over time, or a feeling as if you cannot breathe deeply enough to get enough air into your lungs. Or maybe you find it hard to breathe when you lie down flat.
Right. What's also good to know is that trouble breathing can be particularly worrisome if you suffer from high blood pressure or swelling, or when you have chest, head or back pain, a blurred vision or dizziness. All those signs can be warning signs which can point to pregnancy-related problems like preeclampsia, but also to problems which are unrelated to your pregnancy, such as an infection in the lungs or a heart problem, for instance.
Yeah.
Therefore, the only right thing to do in such a case is to call your doctor, okay?
Right. So again, the signs that we have mentioned in this video do not necessarily mean that something is not right, okay? However, we wholeheartedly recommend that you speak to your provider when you observe one or even several of them, because the safety of your baby and of course your own safety is always the top priority.
Right. If you have found this video helpful, we would be super grateful if you could leave us a like or even a comment in the comment section below.
Yes, and for more useful tips and tools on pregnancy and baby related topics, make sure to subscribe to our channel and to hit the bell.